Dr. Jennifer Taylor, I'm excited to hear what you've got to say about how people can get well and reverse disease using chiropractic. And your area of specialty is upper cervical chiropractic. I'd love to hear more about that, the kinds of problems that this is connected to, and the kinds of results people can achieve when they use this type of therapy.
Well, upper cervical chiropractic is a specialty in the chiropractic profession. There's about 1,200 of us in between North America and Canada, a few peppered with throughout Europe. But as far as the designation of having a diplomate in upper cervical care, there's less than 70 of us in the world. So it's something that I find that most people need, especially if they've been through chiropractic care before and they haven't gotten the results they're looking for. Maybe they've kind of reached a plateau. We're seeing a lot of patients with traumatic brain injuries, like and the sequela from that, like post-concussive syndrome. The vertigo, the dizziness, the confusion, the anxiety, the depression, neck pain, migraines, headaches, all the things that come with some sort of head injury or neck injury. So those are the things that we're really focusing on right now because for some reason, nobody's really getting the care they need. It's basically just a runaround of drugs and more drugs, antidepressants. So we're trying to give them an option outside of that paradigm because most likely what we're finding is it's actually a mechanical issue up in the upper cervical area right here.
Amazing. And so then a variety of different symptoms, pains, problems, and you're saying even chronic degenerative disease. Like someone could have, I remember when I was producing for The Truth About Cancer, there was someone that had stage 4 cancer and he used chiropractic and it was the only therapy that he used. And again, I know it's one case study and I'm not saying that anyone else should do it this way, but this is what happened. His cancer went into remission. Is that possible?
Well, there's no adjustment for cancer. However, the nervous system is the system that controls everything in the body, including the immune system. If you look at cancer, well, ultimately, cancer is a failure of the quality control in our body. The quality control in our body is the immune system. It allowed this cancerous cell to divide and multiply, and that therefore you get cancer. So I'm simplifying it quite a bit, obviously, but I think, as far as this beautiful creation called the human body, I don't think there's any coincidence that the most important system in the body is completely encased in bone. So, it's one of those things where you really have to kind of just lay down the foundation, the basics of it, because sometimes I think we can educate ourselves out of common sense. So looking at the nervous system as the master system of the body, with the brain being that CPU of our body. And where I focus up here in the upper cervical region, which is the base of the skull, C1 or the atlas, or C2, also known as the axis, it's called the cranial cervical junction. And think of that as like the master breaker to the nervous system. It's one of the most neurologically dense areas of the nervous system. And when that area goes out of alignment due to various traumas, toxins, or even sometimes emotions, where we get all bent out of shape, as you can probably see a lot of people these past 4 years get all bent out of shape, it actually causes, trauma or subluxation up in this area, causing that bone to go out of alignment, torquing the brainstem, causing problems in the cardiovascular centers, in the postural centers, as well as the respiratory centers. So those are some of the areas that we can quantify.
Amazing. And so then, are there any at-home therapies people can do? I know that one of the things my wife does often is she has this kind of roller type thing, and like one of the companies is Dena roll, and then she puts that underneath her neck. And I'm not saying that this is necessarily the same thing, but it's a therapy that's helping with the curvature of her neck, because people having straight necks creates all these problems. Mine is better than most people because I'm a surfer, and I think, maybe you can tell me if I'm wrong, but I've got to keep my neck up like this when I'm on the surfboard to keep my head out of the water. And I think it's helped me a lot because I definitely have a pretty good curvature. What do you think?
Well, you've actually brought up a really good point. So as far as an upper cervical chiropractor, is concerned, we are looking at the structure of the spine. Because the brainstem, where the atlas surrounds, that area of the brainstem controls all of your postural muscles. So first of all, mechanically, we really have to get the atlas back in proper alignment so the muscles that support the spine are functioning properly and they're well balanced. Number two, you bring up the curve of the spine. So in the neck and the low back, we have this backwards C shape called a lordosis, and they really support each other. And that is actually part of our shock absorption. So every time we walk, run, play, whatever we do, we want to have that shock absorption. When you lose that curve, especially in your neck, you create a pounding pressure. And that's what perpetuates the degenerative change that we see later on in life. Now, everybody says, oh, I'm getting older, so I've got arthritis in my neck, and I just don't like to play the age card. I have actually seen 97-year-old spines that look better than mine did when I was 21. It's because she had that curve and it was just beautiful. It was gorgeous. And we actually call that area the arc of life in the neck. So the dental roll that your wife is using, that's fantastic. It's a wonderful piece of equipment that helps mold. We call it spinal molding exercises. So those are some things that you can do, but ultimately the brainstem really needs to make sure there's no torquing or twisting at the atlas level to make sure those postural muscles are getting the right information so you can hold that proper curve. Now, when we lose that curve, not only do we have that pounding pressure, but this area right here called the arc of life, the spinal cord needs that, it needs that slack in there. So when we lose that slack, we actually start creating like a pulling action on the brainstem itself because that spinal cord turns into the brainstem at that level. When we start doing that, some of the elements of the brain, like the cerebellar tonsils, can actually go into the foramen magnum, which is the big hole at the bottom of the skull, and start crowding out the brainstem. So that's going to cause even more problems with even CSF or cerebral spinal fluid flow going in and out of the brain. The brain needs that constant flow of fluid to send nutrients to the area, to cushion the brain, but to also get the waste products out. So if we don't have that curve, then all that's being compromised as well. So all of it matters, and that's a great thing to do at home.
Oh, awesome. I'm so glad I brought it up. And I'm glad that you didn't debunk a myth with me, no, that doesn't work. And I'd be like, but it seems like it does. It makes her feel better. It makes me feel better when I do it. And it actually is, it almost feels like getting a massage, right? So it's, I mean, what does it cost? Like $10?
Yeah, it's not an expensive, an expensive tool. And it's actually very relaxing because if you think about it, what are we doing all day long? We're working on computers. We're looking at our phones. So that forward head posture is becoming an epidemic in society. So at the end of the day, one of the big things that I do is I use, I do my spinal molding exercises as well. You want to lie on your back using either the dental roll. We use one from Pedibon, which it's more like a wedge that we use, and but they both do the same thing. I lie in it for 15 minutes, and it really relaxes my entire body because as a chiropractor, I'm over people all day long, and when I'm doing that, my head's down. I'm on my phone just like anybody else. I'm on a computer doing my admin work. And so I want to make sure I'm doing the opposite of what I do every day because computers and phones, well, they simply aren't going away. So we have to do something proactive to make sure that we don't have, further degeneration in our spine.
Wow. Okay. Thank you so much. All right. And so then any other tools that people can use? One, they could go find an upper cervical chiropractor such as yourself and look for those around the world. How do they find those? Two, for those that, for example, they may have their regular chiropractors, is there any way they could direct those chiropractors or ask them for a certain type of adjustment that would in some ways be helpful? And then thirdly, any other exercises or at-home tools that people can use, and some of those may be even dietary, if you think that is applicable to help with this type of therapy.
Well, as to your first question about where to find an upper cervical chiropractor, well, there are 70 avenues to take. One is going to a website called uppercervicalcare.com. it's kept very up to date. All the credentials of those doctors are on there, so you know exactly, where they studied, what type of technique they use, and they are focused on the upper cervical area. So they're specialists. I said this is a specialty within the chiropractic profession. So unless you go there, it's very difficult to really know if that doctor specializes in that. And I can't stress that enough. All chiropractors will look at the atlas, but upper cervical specialists, they're the ones that do the due diligence as far as to find the exact vectors. Everybody that goes to an upper cervical chiropractor is going to get a precision adjustment. It's either done by hand, it's done by a handheld instrument, or sometimes we even have a table mounted. Every technique is a little bit different, but they all have the same goal, is to move that atlas back in the proper position and restore proper function at the brainstem. As far as nutrition is concerned, yes, the 80-20 rule, really. 80% of the time you want to make sure that you're eating anti-inflammatory foods. Lots of fresh vegetables, proteins. You just want to make sure you're not eating a whole lot of sugar. I mean, our entire diet, Western diet, is just full of sugar. And let me tell you, people don't even know what real food is anymore. It's amazing for me to see how many people are going, oh, I eat really well, low fat, no fat. And I'm like going, all that is chemicals, throw it all in the trash. Let's start over. And I focus on just eating real food. And it's really, you have to teach people how to eat real food these days. They don't even know what it is. So it's a lesson. It's an onion that we have to peel. And so, teaching patients that is part of what you need to do as a wellness or whole body doctor, because you have to look at it from not only a mechanical, aspect as to, is there an issue up here that we have to make sure we move that bone, or are they even feeding their body what it needs so those cells can actually regenerate and heal at the same time.
Amazing. Thank you so much. And then finally, just a personal question in regard to the work that we're publishing. You've been in a couple of our films. From what you know of the work that we're doing, do you feel like it's making any impact?
I think it's making a great impact. It's getting the word out, not just from my office. I have some of the patients that, have come into my office, they're from different states and they travel far because, again, it's a niche in the chiropractic profession. So there may be entire states that don't have one of us there, and they insist on coming to see me, which is fantastic. But I really want patients to find somebody closer to them. That's why I want to give that uppercervicalcare.com website so they can find somebody in their area. And it's giving people an idea that chiropractic is more. There's more out there. If you haven't had success with other techniques, upper cervical may be exactly what you're looking for. It's something that most people have never heard of. And I actually call it the greatest health secret you've never heard of, just for that reason. So,
well, that's applicable considering my company's health secret.
Yeah, exactly. So it's this docuseries has really opened the eyes of people, and it gets me so excited to not only see patients in my office, but to be able to send patients to colleagues that I know, love, and adore, because we are such a close-knit family in the upper cervical world, that these people are now getting the care they need. And I get to hear the stories coming back. I even have some of them say, oh my gosh, I had such a great experience at so-and-so's office. I'm so glad that I saw you in Jonathan Otto's docuseries. It's changed our family's life. So that just is near and dear to my heart. So I thank you so much for allowing me the opportunity.
Thank you so much, Dr. Taylor. And I know that, and this is back to your career and your profession, have you seen people's lives be changed?
Every day.
Like what?
So let's see. I have a patient that recently just came in, and he actually started with me, and then and his whole family started coming because he got so excited. So he has had this chronic nagging pain in the side of his head. He said it felt like ice picks going up in here, even just turning his head. This has been a 10-year journey. From 10 years, think of a decade, he's had this pain. He's been to 15 different chiropractors. I mean, we're talking about, this guy has not given up on the chiropractic community, which typically most people are like, one chiropractor, didn't work, chiropractic didn't work, and they just throw everybody under the bus. Well, he's so persistent. He knows this is the case. But not only that, it's blood pressure. His blood pressure was high, but he exercises. He's a healthy guy. His blood work all looks great, but his blood pressure changes with the way he moves his head. It was the craziest thing. He says, I just know this has something to do with my neck. And so he came to see me. We did the full workup. He got his first Atlas alignment, and that pain gone. Hasn't returned since that one adjustment. Now, blood pressure, that's going to be a little bit more ongoing because we do have that curve change to make. We still have that structural change to make. But he's noticed a change with his blood pressure. Every time he turns his head, his blood pressure doesn't shoot up. Every time he gets stressed, his blood pressure doesn't shoot up. It's kind of like it's regulating right now. So you can actually see that. Now, is chiropractic a cure for blood pressure issues? All I can say is the blood pressure centers are at the brainstem. If the brainstem is not functioning properly, that could be the mechanical issue that is causing it. And it's incredible that he has such tenacity, that he is out there still seeking what he knows is right. And he finally landed on my door. And that takes a long time for people to get there. Typically, I don't see people until they've been to 2, 3, 4, 5, 6 different doctors, not necessarily just chiropractors, but they've spent tens of thousands of dollars, and they sit there in their report and they go, why haven't I heard this before?
Thank you so much, Dr. Taylor. It's awesome.